how do we evaluate GERD? So a patient comes to us with these chronic symptoms of GERD. We look at his lifestyle, his alcohol intake, smoking, obesity, BMI, his food habits, and all that. Then basic investigation we do is an upper GI endoscopy. Upper GI endoscopy, basically you can have evidence of GERD, you can have ulcers and inflammation at the lower end of the esophagus. We call it esophagitis. We grade it into 4 grades, A, B, C, D. Then we go in and look at the lower esophageal sphincter. How is it lax? Is it slightly lax? Is it very lax? So we have a Hills grading which we do that, and then we assess for hiatus hernia. And if there's a hiatus hernia, we look at the size. In addition, during endoscopy, you can have evidence of complications of chronic GERD, something called a Barrett's esophagus, when the esophageal lining changes into gastric type lining, and Barrett's esophagus can actually lead to cancer. Then you can have strictures, narrowing of the esophagus. All these things are also stuff which we assess during the endoscopy. Most of the time, patients, with an endoscopy itself, the diagnosis is made and when we treat them. But in some patients where if we are planning there's no good relief with medication, or the classical endoscopic features are not available, we do a test called 24-hour impedance pH metry. So 24-hour impedance pH metry is a test which we do for GERD, where we actually put in a wire, a thin wire into your food pipe and your stomach. Then over 24 hours, it measures two things: the pH changes, because that looks at the acid reflux, because when the acid comes into your chest, your pH will drop, and then it looks at the impedance changes. So impedance is for the non-acid refluxes like bile, air, and food refluxes. So for these kind of things are measured by the impedance. So in selected patients, this 24-hour impedance pH metry, it helps us quantify the amount of reflux you have, and also it helps us corroborate your reflux episodes with your symptoms. Are you actually having symptoms with reflux? Then, of course, in special patients, special cases, we do extra investigations like barium swallow and esophageal manometry for these patients.